So for those of you who haven't, so on the call we have Bill Snyder from Civic Stewardship and Christy Nash and myself, Sylvia Chu, from Tamarack Deepening Community Learning Community. So what we are hoping for is, and what we use these communities of practice for, is to both introduce new ideas around this notion of building and strengthening social inclusion, the social fabric of our communities, and the roles that are needed to create strong communities. And our hope is that through this learning we can accelerate each other's progress because we inspire each other with new ideas. So do we have any more information at all, Christy, from Pauline and her colleague in terms of what they're wanting and hoping from today?
So we have here that they're neighborhood community development. They're interested in building on existing initiatives in a way that embraces emerging practices.
Beautiful. Okay. Do we want to go forward to the next call, or is there anyone else that's joined the call that we should bring into the conversation now?
Not that I see.
Okay. So, on to the next slide, if you would.
Mm-hmm. Sorry, Sylvia, I'm realizing that I'm doing it from my double screen so I can keep active.
Other things?
Yeah, so you go ahead and I will move it as I can. Sorry about that.
Okay, that's good. So we are really pleased to welcome Bill Snyder from Civic Stewardship to our dialogue today. And then what we want to do at the end of this call, after we've learned and had a chance to go deeper on your work, Bill, is to just bring the folks on the call back into a dialogue around how we might want to shift up our process around this particular community of practice so that it's really relevant and engaging for the folks in our learning community. So we had a couple of questions that we wanted to ask folks about that in particular. But it is my pleasure to introduce you to William Snyder. Do you prefer William or do you prefer Bill?
Bill is fine.
Bill's fine. Okay. So I went online and I learned a little bit more about you, Bill. So you have been doing lots of work in the realm of civic stewardship that promote community well-being at the city and also at regional levels. You're based in Massachusetts, is that correct?
Yep, in Boston area.
Ah, okay. And Civic Stewardship, the organization that you are with, your focus is really about building the capacity of communities to care for one another, right?
Yes, for their members and across cities, within the community and across city, and across communities at the city level.
Oh, okay. But you know, one of the things that I was really excited about as I learned more about you was you also have a very deep interest in and are recognized as quite an expert in the realm of communities of practice. So I'd welcome you to kind of share that piece as well and how those pieces fit together.
Okay.
The learning and the creating of civic stewardship.
Mm-hmm.
So it is. So thank you again for coming and joining us on the call. And I would love to turn it over to you at this point to say a little bit more about your work and teach us about what you've been up to and what you're learning.
All right. Well, just to sort of frame what I'll go through today is I'll start with concepts related to what I'm calling civic stewardship. Give a brief sort of case introduction of an application that is live here in the Boston area, kind of an action learning lab. I'll talk about where we're going next with that, and then we talk about applications. I'd love to hear questions and any, in fact, any. I don't know how if people can offer questions during as I'm going through the concepts, how you want to do that, but I'd be glad to stop at any point and address questions as we go.
Good.
my own background, you alluded to a bit of it, is in organization theory. I started in the early 80s and 90s helping large-scale organizations become more participative. And my original interest in that was that I had done some work in the nonprofit sector and had been frustrated with the lack of progress. And you know, with the Aspen Institute for Roundtable for Community Change found in the last 20 years, for example, that there have been very little impact by community organizing initiatives, even the best ones, on achieving population-based results related to health or dropout rates or poverty, etc. That was a US-based evaluation, but pointed to a challenge that we have. And so my interest was, what can we learn from large-scale organizations about participation that promotes performance and for the organization and makes work more meaningful and engages people at the front line in making decisions about the work and promotes their own learning and innovation, et cetera. And I think we've learned a lot from the organization context, but my aspiration was always to come back to the civic context, and that's what I've been doing the last 10 years. Along the way, I started to focus on organizations as learning systems and connected with Etienne Wenger. We developed this notion of communities of practice as it's applied. He developed the seminal work on communities of practice, the theory, and how they could be applied. And then we worked together on how could the social structures for innovation, learning, and change be applied at the organization level. And we did that for a number of years. Both of us had an interest in how to apply this more broadly, and that's what I've been doing since then. So as I talk through the civic stewardship approach, I'll highlight where community of practice applications fit in. I guess before we jump into the slides, I'd like to sort of frame this in the context of other major approaches to change in the civic sector, including both collective impact and community organizing. As you look at this, you might sort of note one of the themes, and Tamarack has been a leader in terms of helping to share awareness and applications related to collective impact. One of the challenges, I think, in that field has been how to connect what is happening among institutions who are collaborating more on topics related to whether it's health or education with what's happening at the community level. How to instantiate, as it were, the collaborative insights and capabilities that institutions want to promote at the in neighborhoods. So that's one distinction we'll talk about here in this approach. And related to community organizing, on the other hand, often they are focused in particular neighborhoods and can end up being isolated and not influencing change at the citywide level, which is crucial for some of the institutional policy changes, et cetera, that have to happen to support what's happening in communities. So as opposed to some of the challenges collective impact institutional collaborations are facing, communities are facing a challenge of connecting often with other neighborhoods and collectively with institutions. And another challenge they've had, of course, is sustainable funding. So civic stewardship, in a sense, is one way of looking at it is a more systematic approach to community organizing, which tries to take community organizing at scale by connecting communities to each other and connecting them as equal partners with institutions across the board, whether it's businesses or government agencies, foundations, etc. So with that, I'll dive into the slides. The first one just notes that this way of thinking about community change as a nested phenomenon and framing it at a broader level as city transformation, because there's been increasing attention to cities over the last 5 to 10 years and the power that cities have for changing the world. But communities are elemental elements and components of cities, and so I'll make that case. And finally, related to the sort of organizational perspective, what are the capabilities that communities need for sustainable change over time? This next slide just highlights the power of cities. I mean, we passed a threshold where most people in the world are living in cities. It'll be 70% by the year 2050. And you know, cities are driving the economy. They're responsible. Cities over 50,000 are responsible for 70% of global carbon emissions. If we can change what's happening in cities, we've gone a long way to changing what's happening in nations in the world. So how do we achieve breakthrough results in cities? And one of the way I frame it here is that one of our challenges is changing an integrated system of policies, programs, and practices. For example, in the U.S., we've long had policies that provide for poor families access to health insurance for their children. But many families weren't using that. And many municipalities have implemented a kind of a community policing approach. But the long-term distrust between the police departments and neighborhoods has meant that community policing didn't go very far. So there's been a challenge, even when you change a policy or develop a program that's meant to have an intended effect, between the cup and the lip, as it were, between the institution's intent and the efficacy and application at a neighborhood level, there's been a big gap. So that's a big challenge that we have, that I believe a more systematic approach to community change can help solve. And that gets to the second point, is how do we develop at scale synergistic partnerships among communities and institutions? That's the only way that we'll be able to bridge this divide among policies, programs, and practices. And in order to do that, in order for communities to be as powerful and as systematic as institutions are about, for example, measuring impact, and then monetizing the value that they create in order to fund efforts at the community level, they need capabilities that we associate with leading organizations. And I refer to this as a platform of stewardship capabilities, which I'll go into more detail on. But at a high level include measures, participative methods, social media or civic technology applications, and self-funding instruments, monetization. The figure below, the social behavioral versus technical emphasis, suggests that, for instance, in healthcare, most of the influence in terms of results is on changing practices, health habits, etc. But most of our emphasis in changing health, at least in the U.S., has been funding very expensive, research on new medicines or new technologies, and not paying nearly enough attention to what is it at the community or social cohort level we'd have to change in order to get better outcomes for people and for our society. The next slide is sort of a summary slide of what we mean by community-led collective impact. A collective impact approach that sees community development and community organizing as important an element as institutional collaboration. So this is oversimplifying it, but if you look at that top oval, that would describe where a lot of the focus for collective impact is, in terms of making sure that you have institutions across the different sectors lining up around a particular outcome measures, or for instance with the cradle to career process, understanding what happens at the life cycle of whatever issue is that they're looking at, and having a shared framework, having shared measures, having a way of communicating, having a backbone to help support that. A lot of that has been focused at the metro level among institutions. But to get to this convergence of policy, program, and practice, we need to be as systematic at the community level, at the neighborhood level, and not neighborhoods only in isolation, but a community, as it were, of communities. So for example, if we're trying to change healthcare results, and we've got some new institutional policies and programs that say, let's have more community outreach to residents to help them understand what it takes to reduce pediatric asthma, for example, where it's on average the cost is about $700 per family for unnecessary emergency room visits when families don't know what they can do to help prevent or treat pediatric asthma most effectively. Outreach workers often aren't funded sufficiently. Sometimes they aren't funded as residents in the neighborhood. There isn't often the funding that would need to happen to engage families over time. And so part of what civic stewardship is addressing is what would we need to do to be that systematic at a neighborhood level and do that in a way where neighborhoods could talk to each other about how they're doing to address health issues or, for instance, improve the energy efficiency of their houses or address, how to help improve results for early childhood education. A lot of these are family-based and practice-based, but can be supported by communities. And there's a lot to learn about how to do that. And that platform at the bottom suggests here are the kinds of capabilities communities would need in order to support sustained efforts. And these same capabilities are the ones that would enable communities to talk with institutions as equal partners about, for instance, how are we measuring results? And what is the knowledge base we have about addressing whether it's pediatric asthma or whether it's early childhood education or household financial management? What does it take to have that kind of knowledge at the community level? So this next slide basically draws on the long decades of research on social determinants of health, more recent research on so-called neighborhood effects, but it goes back to that figure earlier that noted how much of change depends on addressing social behavioral conditions to influence outcomes. The inner circle of ovals related to typical civic issues, energy, education, economy, etc., highlight at least one example of the social behavioral norms that influence outcomes in each of those areas. So for health, it's habits and screening. For education, it's parental involvement, particularly in school for school-age kids, but particularly for kids 0 to 3. For energy, household practices. If we could get people to use just the energy efficiency appliances and practices we have today, we could solve global warming. Just doing that, that's what the research, McKinsey research and other has shown. We could reduce energy use by 20% by changing practices in households and businesses. But what influences those practices in any of these areas is largely driven by one's peer groups, what one's neighbors or circles of family and friends are doing, social norms, social networks, role models, etc. So how do we influence that whole domain of social interactions and do that in a systematic way that's as intentional as what we do now in terms of conducting research and trying to translate that into better policies and programs? What would it mean to be that systematic in the social dimension? And here's where we're going to draw on what we've learned in organizations. Organizations, although people are paid, there's no way to force people in organizations to be creative, to address interpersonal conflicts that get in the way of problem solving, to show up and give their all in addressing a customer's problem. Those are all personally given capabilities that depend on organizations learning how to engage people, engage their hearts as well as their heads and hands. And that's a lot of those are social principles of social psychology that apply to people in any context. An example is goal theory. I mean, what we've learned in social psychology, we had this, what's one of the most robust theories in organization science, is that when you set a clear goal and you have a way of measuring progress and you can give people the ability to make improvements that lead to progress, those three conditions are a system that will generate motivation and focus over time. And that's why the collective impact work draws a lot on the importance of measures and a shared agenda. But this applies at the community level, it applies at individual level. So several of these capabilities relate to that. The measures capability, for example, on the left-hand side, the second one down, social media can help make measures of results. Let's say we have in a neighborhood where we have a youth employment rate of 25%, that after a year's work, we've improved that neighborhood rate to 35%. Social media can help make that more visible to people, help them see that there's progress, and help them feel more motivated to participate in those local initiatives. Those are more of the technical issues. The ones at the top, block stewards, neighborhood coalitions, these are ways of being intentional about organizing people in an ongoing way to provide stewardship for particular topics. So you could imagine a neighborhood coalition not only for the overall neighborhood desired outcomes, but also focusing on particular issues like how do we improve energy sustainability in our neighborhood, or how do we help families with kids 0 to 3 understand what resources are available and connect them with other families to improve access to daycare, or spread the learning about what parents need to know about their kids' cognitive development. Coalitions can help make that happen. This role of block stewards I'll talk more about later. It's essentially neighborhood-based residents who provide ongoing research to connect families and others in the neighborhood on issues they care about. Participatory problem solving is a better known sort of bucket of approaches, whether it's future search or different ways, the human-centered design, other ways of getting people together to solve problems and innovate. The funding model relates to what are the ways, if we improve, for example, youth employment or pediatric asthma or cancer screening rates, where the healthcare organizations, government agencies, or private get clear benefits, save on average potentially hundreds of dollars per resident in a neighborhood. How could the community capture some of that value because people in the community have helped shape changes in behaviors and social norms that have changed habits, that changed results? Without the community's partnership, that isn't going to happen, evidence shows. And if communities help make that happen, they should share in the value, and that can help them continue the work and also invest locally in a variety of ways. All right, the capabilities at the bottom, the knowledge base, is really just to imagine for any issue today with all the new technical innovations, the new research on any of these topics. For example, recent research, actually it's been around for a while, the research on the number of words and the quality of interactions that parents have with babies has such a strong influence on whether they're ready for school when they're age 5. But 90% of parents didn't have that knowledge 3 years ago, and many of them don't have it today. And even if they had the knowledge, they wouldn't be sure necessarily what to do about it. That's the kind of knowledge that exists among researchers and in some cases among policymakers. How do we make that knowledge base accessible at the neighborhood level? Communities of practice is really this point about if we're going to make neighborhood change really sustainable and really powerful, we have to connect neighborhoods. And for example, you could imagine a neighborhood working on early childhood education, connecting with a coalition of people in other neighborhoods as a community of practice on how do we make that happen and build that knowledge base and collectively influence institutions to make change happen. The fundamental values across the board are promoting learning, promoting connectedness so people can take that learning and steward that learning and innovation to make changes that people care about, and working to align those changes with what is needed not only in our neighborhood but in others. And so we're learning about not just local impact but impact that is sustainable and scalable. Okay, I'm aware that I've probably been talking for about 20 minutes, so I'm going to try to wrap this up with a mini case in the next 7 minutes, and then we can go to questions. Does that sound okay?
Sounds amazing. This is great stuff.
Okay. All right, so what we've done is I asked a major foundation here in Boston, I said, I've got some ideas about civic stewardship, and one of the key ideas is about how to do measurement. I mean, we've all heard about public data, and there's big opportunities there, but getting it down to the neighborhood level, even in cities that are doing the leading work with indicators projects, has been very difficult, particularly below the census tract level. And so I asked them, where is a neighborhood here in the Boston metro area? The city itself is about 650,000 people. About 100,000 people are at the poverty rate. And so there's about 30 or 40 neighborhoods of about 2,000 each that have poverty rates over 25. And I said, where are there neighborhoods that fit this profile that would be interested in learning how to do measurement as a foundation for a more rigorous approach to local stewardship and et cetera, be able to do this in a network of neighborhoods and influence institutions. And they pointed out 2 neighborhoods, one of which is well known and actually has national prominence, but also gets so much attention they're sort of overwhelmed. Another one was this small neighborhood of 1,500 people called the Talbot-Norfolk Triangle. And these slides will be available, and they have hyperlinks, so you can get more. The TNT in the middle of this map is a hyperlink to the Neighborhood Association website. But this tiny little neighborhood of 13 blocks was where we started, and we started because they already had an ongoing neighborhood coalition called Neighbors United. And you can see some of the demographic statistics there. So it's a majority-minority neighborhood, 20% below the poverty line in this case, 30% of people in the neighborhood without a high school degree, 2 times the median crime rate in the city. So here's what we did. We looked at youth employment because it was an issue that was important to the neighborhood for several reasons. One, because there was a big gap between youth employment in this neighborhood. It's about 25%. For middle-class neighborhoods, it's typically about middle-class and mostly white neighborhoods. It's about 60%, which means for middle-class, kids that are aged 15 to 24, they basically have a job if they want a job, because they've either got a job or they've got other kind of educational opportunities. For kids in minority neighborhoods, mostly 90% African American or Hispanic, who are living in neighborhoods with at least 20% poverty, the average employment rate is about 25%, and 90% of those youth want jobs. And when we did a survey, they said they wanted jobs because they wanted to be able to buy clothes and books and be able to save money, but about 40% of them were sharing whatever they earned with their families. And so the other thing that happens is when youth are vulnerable to peer group pressure and et cetera, and when there aren't job opportunities in the job market, they'll do what they can do. And in many cases that leads them to not only drop out from school, but for many of the youth of color in these neighborhoods, they have a much higher rate of incarceration, for example, than you'll see in middle-class neighborhoods. So youth employment is important for not only for economic reasons, but for engagement reasons that promote education advancement and has a big influence on the rates of violence. So what we did is we said, how do we promote community-led leadership and use these civic stewardship capabilities to help make that sustainable and have impact on population-based results. You can see some photographs of the youth. We pulled together a team of about 10 youth. We drew, again, on relationships in the neighborhood that we had. We started out with training the youth, and we had an alliance with a local university, University of Massachusetts in Boston, developed a survey. All the youth had iPads. They went out in pairs. This is a relatively high-crime neighborhood, so they went out in pairs and with supervision went door-to-door to every one of the 525 households in the neighborhood. And what we didn't know before we went out was how many youth have jobs, and we certainly didn't know because there's no public data on this. There wasn't public data at this neighborhood level on how many youth had jobs. There was certainly no data on why they didn't have jobs or when they had jobs, how they got jobs, and what were the barriers, et cetera. And so these youth went out with their iPads, with their survey, and interviewed other youth. And a big part of the measure's insight here is the importance of social trust to gather this kind of data. And so it was youth talking to youth. It was youth for an explicit purpose to help results at the local level. It wasn't a federal agency coming in and trying to solve a problem and develop research and change policy and then maybe something will happen. This was a local initiative, and they collected terrific results. They had about 80 different questions. And just as an example of one of the results they had was they asked about programs that existed that would pretty much guarantee a youth could get a job in a subsidized program over the summer. And what we know is that when youth don't get a job in the age group, particularly 15 to 19, they're much less likely to finish school, much less likely to get employment as adults. Half the African American men in this neighborhood over 40 don't have jobs, 50% unemployment rate among adults. So there aren't a lot of role models, social networks, and supports for youth, but there also wasn't much uptake relatively with these employment agencies. So this was an important finding, that many youth hadn't heard of the employment agencies. They'd heard of them but hadn't applied because they were intimidated in some cases by the application process. So the youth got these survey results, and they held what they called innovation circles. They took the survey results, they looked at them, and they said, what's going on behind the numbers? What's the qualitative data? What do we know as youth about this? And they developed responses. They developed a job fair where they had over 100 people show up, and they had 13 employers. They connected youth with employers, helped them fill out applications in person. They held a special event at a library to help do some hands-on support with youth to help them get through that barrier. They had a peer group readiness program where they learned about job readiness skills, interviews, resumes, showing up on time, some of the handling personal development issues. So they didn't try to solve the problem with a silver bullet, and they didn't try to solve it in the abstract. They tried to solve it for the youth in this particular neighborhood, and they tried to build up a capacity of skills that would help youth explore jobs in different areas. And as important as both of these, they developed a youth membership community in the neighborhood where youth sign up. There's 350 youth in this particular neighborhood. They sign up to be members of a youth community that helps youth promote their own personal and professional development and get jobs. And they've developed in partnership with a technology community called Code for Boston. There's also one called Code for America. Social media apps that help youth find out about jobs in the city. It also has a peer-to-peer element to it where they can help each other, sort of, here's the job I heard about, did you go, and did they, what should I wear, etc. So there's more of a social interaction behind it. All right, those are little 2-minute videos, those photos there, and hyperlinks to those. So that's a bit of a case. What we're doing now is we're moving on to what we're calling block stewards, drawing on strong evidence that outreach workers, especially residents based in the neighborhood, can help residents learn about resources that do exist. As we saw in the youth example, many times those programs and the policies exist. They can be good ones, but people in the neighborhoods aren't taking advantage of them. And there are ways for, as we saw also in the Youth Hub example, ways for the neighborhood to fill the gaps and in some cases influence the institutions that offer these programs. And the Youth Hub in that neighborhood have done that. They've worked with some of the youth employment programs to change their application. Well, they're starting to work on changing application process, but right now they've already been helping them increase their local awareness. So these, we call them block stewards because they're going block by block and they're performing the role and modeling the role of stewardship in their communities. They help inform residents and they collect data from residents, but they do that because they build social trust. They're from the neighborhood, they engage with people personally. They also help neighbors find other neighbors who have shared interests. So for example, the block stewards we have now, these are adults, are in the process of forming a walking group, and another one forming a group to help homeowners learn about weatherization programs that are available, but people aren't using and can make a big difference in terms of savings. So that's a bit about what the block stewards, and again there are links to current programs outside of ours. And the last slide, another slide I'll just show is that if you think of the neighborhood as having a number of issues and thinking about how can we cultivate via block stewards role and other ways a kind of a neighborhood constellation of coalitions, each of which could have partners in other neighborhoods, again to develop that citywide basis for neighborhood change. And let me say, I'm just going to flip down. There's other slides here that talk about some of this in more detail, but I'll end with this slide. We started with this pilot in the lower left-hand corner in the Talbot-Norfolk Triangle. What we've already started to do is to spread out and scale on different dimensions. One by neighborhoods. CIA is another neighborhood, the Community Improvement Association. 923 is a census tract number for another neighborhood that's just in the process of building a coalition. The issues on the lower right-hand side of that broader Codman Square are indications that we're moving from youth employment to other issues. We're growing the number of institutions we're engaging with. We're building on the capabilities that are in the heart of the circle. And our aspiration is to build, as I said, there are about 40 communities in the Boston area with relatively high poverty rates. We'd like to be in 20 of them in about 5 years. And this process, of course, applies to middle-class neighborhoods. And so that's a absolute, we will get a critical mass of power and influence in the city when we do both, and that's our intention. And then, of course, we think this is just as general management applies for any business, civic stewardship, a systematic approach to community organizing, a community-led approach to collective impact applies just as those two approaches do in any city. All right, so I'll stop there.
Wow. Can you, one of the burning questions I had as you were reviewing this is, what kind of time frame did the work that you did in the TNT neighborhood unfold over?
It's been about 1.5 years since I first shook hands with people in that neighborhood. It took us about 6 months for me to get to know the lead coalition there. As I said, the priority issue for them was youth employment. I was agnostic. I didn't care what issue it was. It took those several months just for them to say, measures because often measures are used by foundations and institutions to evaluate what's going on in the neighborhood. They're not owned by the neighborhood.
Right.
So there's general resistance often at the neighborhood level in talking about measures. So we had to make it clear collectively that this was something the neighborhood was going to own and that could be a foundation for community-led stewardship. So that took several months. We ended up saying, okay, we're going to focus on youth, and we did the surveys in the next 6 months. So we started in January. By the end of December, we had already collected the data, going household by household. We started the innovation circles in January, and they did their first job fair. I think it was in February or early March, and started doing a lot of the initiatives for youth that spring. We're now in the second year for what the youth is doing, and we started the block stewards, the adults in this case, to address a broader set of issues. We started those in June, and they're part of a network of champions that are working in other neighborhoods. Just as a highlight, there's a technology community funding group here in Boston that includes tech entrepreneurs from throughout the metro area. And just last night, they had a community crowdfunding kind of event, and they gave an award to Youth Hub as being one of the best nonprofit community-based initiatives in the city, and they won $50,000. So it's starting.
Wow. Were they thrilled?
Absolutely, yeah.
And where do they want to go with that next?
Well, they've already started talking with other neighborhoods. There's other neighborhoods in Boston, again, meeting the same profile. In South Boston and Mattapan, you wouldn't know those names, but there are other neighborhoods. They'll be looking for census tract size or somewhat smaller. That is between 2,000 and 4,000 people. Typically, that means between 500 and 700 households. But so they're going deeper on how to do measures, how to use social media to build what they're calling youth membership communities. They're working on this monetization approach. The cost of a disengaged youth over a lifetime is $700,000 when you add it up. And so they're making the business case. They're collecting data that'll help them do that, and they're starting to scale.
Wow, that is so impressive. I just want to pause. I don't know, Christy, if you're getting any questions from our friends in Red Deer?
Yeah, I do have a question from Pauline, and it's great that she raised it because I have the same question. Curious to know what the role of the municipality was in this wonderful systematic approach.
Right now, it's been issue-based, so the Department of Youth, I think it's Department of Youth Employment, was at the fair, the job fair that they had. The city and the state have programs for youth employment, and again, I showed you that histogram of the neighborhood results. They were very interested to see that this particular program is not the city-based one, but to see that in their case it was also true that there was low levels of awareness about the program, lower levels of application rates, and very interested to hear from the youth why that was. Going forward, I anticipate, I'm actually at this point, I was helping to get it started, but I'm more of an advisor in this role, so I'm not in on all the more detailed conversations. But the director and the youth are working with every sector, institutions, whether they're businesses, for example, a large retail organization that has online applications that are very intimidating for youth that don't have the kind of privileges and experiences that middle-class youth have. So they're working with businesses, they're working with the city and others. But the city, in this case, although our motto, one of the mottos that we use is Youth Hub, for every youth that wants a job, so every youth that wants a job can get a job, is a quote from the mayor who was elected 2 years ago. I think it's 2. He's clearly, the mayor is very committed to this, but cities have programs and they have policies. What they need are community partners, and we've gotten started with them, but there's much further that we can go. But we don't expect the city to be leading it. I think what we hope is that municipalities will start to lean more on community groups that have the knowledge base, have the measures, have the local coalitions, to see them as equal partners in developing policies and helping to shape them. Not only to be the beneficiaries, which has been the traditional model.
I was also curious about the survey that the youth did door to door, and it sounded, you said it had 40 questions or something. It sounded very comprehensive.
A tree. It sort of depended on which question you asked. Yes or
right.
No. Yeah.
Did you? And I'm thinking about some of the stories that were shared with us at the Neighbors Policies and Programs Conference in Hamilton. Both the work that the Abundant Communities Initiative is doing, which is also a door-to-door engaging neighbors kind of initiative, and also John McKnight's work around the value of gifts, collecting information about gifts, talents, skills. Was there any dimension of sort of asset mapping or asset collecting data that were incorporated into that list of 40 questions?
In this case, it wasn't so much about neighborhood assets. That would actually,
or even individual assets, right?
Yeah,
like these are the skills I have, this is the knowledge I have, this is what I'm interested in, kind of stuff.
Well, for the youth, we focused mainly on what their interests were. For example, one of the survey questions was, what types of career are you interested in? We asked about what jobs they'd had, in what sectors they'd had those jobs. We didn't ask in the survey, what are your particular individual skills? But that did come up in the youth were invited into this peer support development program. I think that's a good one to consider. And again, you're right that is linking it to McKnight's work. It would be a way of starting to collect, and this is something that the youth membership community could do. Be a great idea. Is what are the skills that youth have in our neighborhood?
And even broader, so part of what's sparking this for me is some work that a colleague and I at Tamarack had been involved with an initiative that is unfolding in 2 Baltimore neighborhoods, being led primarily around the issue of reducing risk of infant mortality.
Yeah.
And very much it so aligns with your own analysis that you shared with us, in that, what the impetus to kind of focus on the issue was data that said that Baltimore had at the time in 2008, 2009, the highest infant mortality rate anywhere in the U.S. And when they drilled down, what they began to, so they decided very much like you to take a neighborhood by neighborhood approach, focusing in initially on 2 what they would deem to be priority neighborhoods in the city. And they, between 2009 and 2014, a large part, they've had tremendous success. So they've seen a 24% decrease in infant mortality, a 32% decrease in teen pregnancy, which is a big predictor of infant mortality and a 10% decrease in low birth weight in those two neighborhoods. And the racial disparities that are often as high as 40% have been, they've been decreased by as much as 40% because there's huge racial issues in terms of how infant mortality shows up.
Yeah.
And they themselves, as groups, these two neighborhood-focused initiatives, said they've made this progress because they've done exactly what you said, a very good job connecting the service delivery agencies to one another at the local neighborhood level. But they absolutely recognize to both sustain that progress and in fact move the needle further, the piece that's missing is how do they engage the citizens.
Yeah.
So over the next year, they have committed as agency groups, and a lot of them are as you say, folks that have come up from within those neighborhoods themselves.
Yeah.
And therefore have that social trust that's so essential in the work in the community. They are committed now to doing a gifts inventory within the neighborhood. Because, and at the same time sort of start to build consensus around both what a vision for the future of that neighborhood would be and what some of the concrete projects that folks would like to see happen to move towards the vision. And they're, you know, and with a commitment to having a celebration where they share that data back, but also then can align it with the inventory work that they've done around people's skills and talents and interests. So that when it comes to taking action, they start first and foremost with just rallying the knowledge and skills and talents of the people within that neighborhood to begin.
You know what, just as speaking from my research kind of hat, is I'd be interested in looking at their initiative and looking at the stewardship capabilities and saying, which of these capabilities did you use? You might have different language for it. But for example, did you have the equivalent of residents who were taking the lead on engaging families or teenagers, etc.? What did you measure and who did the measurements and how well did the measures at the local, at the neighborhood level align with what the city cared about or what the research supported? And another one in that story is given the huge social cost of infant mortality, teen pregnancy, low birth weight, those kinds of numbers that you cited are going to realize major savings for for departments of health, departments of education, for the income support agencies at both federal, state, and at all federal, state, and local levels, and will influence safety outcomes. So where are those benefits going to go? Is the community going to capture any of those? If we have really good numbers like those, from research, the kind of value that has for institutions and society, because this work costs money. It costs about $50 per resident for the block steward role and the support that they need in terms of measures, etc. So that's about $100,000 for a neighborhood of 2,000 people. So I would be interested in talking, in that case, if the projected savings for those statistical improvements are about $1 million for a neighborhood of 2,000 people, which could be possible, or at least it would be in several hundred thousands, could we say a 10% of that goes back to the neighborhood?
Right, and what would that look like?
Yes.
Yeah.
That's where I think this needs to go. Two of the biggest problems in neighborhood change that Saul Price Institute for Social Policy at the University of Southern California brought in neighborhood community change gurus from around the country, and I think probably also from Canada. And two of the biggest issues that they named were the problem of community organizing not addressing nested levels of development that would go from the neighborhood to the city. And another one was the funding problem, was not integrating with the broader economy on one level, and on another level not being sustainable. And so I think this notion of paying really close attention to the funding model is fundamental.
I think you make a really good point. Because, you know, the other piece, I just had a conversation with a neighborhood-focused initiative in West Palm Beach in Florida, and it's being led by a foundation. It's still in its early stages, but what I found particularly interesting is they admitted when they decided to take this approach, and they took a broader kind of social determinants of health view on many of the health issues that their foundation and hospital were trying to address, and recognized that they weren't being successful, was that they invested a lot in community leadership capacity building for a long time, and let it be known that they were willing to commit significant dollars, like $200,000 per year per neighborhood for up to 5 years. But the conditions of applying for these funds in these neighborhoods were that the community had to apply, not an organization. So the community leadership needed to identify like a fiscal sponsor who would hold their money for them, but it couldn't just go by default to an organization.
Yeah.
They also had to identify the issues that they felt were the highest priority for their neighborhood that they intended to address through the plan. And thirdly, they had to have hired a director that was accountable to that leadership group of the neighborhood in advancing the work.
Yeah, so there again I'd ask, what's the role of measures in order to give the neighborhood power?
Yeah, and they have done some work on indicators that I've seen, but I can't pretend to know what that is. But they do have a neighborhood indicators component.
In Freddie Gray's neighborhood, if you've heard of what happened in Baltimore, where a youth was arrested and then killed on the way to the jail, named Freddie Gray, his neighborhood of Sandtown is about 16,000. Sandtown, Winchester is about 16,000 people. They spend $1,000 per resident incarcerating people from that neighborhood. So they spend $16 million a year on just incarcerating people. So if that neighborhood, through better local leadership and partnership with the institutions that influence outcomes, could just save half of that, the neighborhood, just that neighborhood of 15,000 would save something like $8 million. And taking just 10% of that, $800,000, would sustain for years the kind of outreach that they need to help keep that outcome sustainable and improve it over time. So that's and over time, let's say the neighborhood reduces incarceration rates down to zero or very minimal, where they're not creating a state benefit by reducing. At that point, the neighborhood, as it increases its collective efficacy and the results across the board, has an opportunity to self-fund. I mean, middle-class neighborhoods could easily self-fund many of these roles. So it's really, I appreciate foundations that take the lead, but I think we'll be short-sighted if we're not looking ahead and saying, what will it take for foundations to be seed funders, but for there to be a sustainable funding model for communities that steward their outcomes in the context of a citywide community of practice that's doing this.
Wow. I really appreciate, one of the things that I've really appreciated is the way that you've been able to quantify the costs right down to the individual and or neighborhood level.
The numbers are there, and they'll be there increasingly, and especially if neighborhoods take the lead. And that will give, knowledge is power. It will give neighborhoods a kind of power that they haven't had until now.
So do you write this up? Where does this go for you next?
Well, it's really, the problem is if you try to talk about community organizing in itself, it would be like talking to business people about the power of general management. They're really mostly an entrepreneur is interested in his or her product or service, not sort of the mechanics of the engine behind it. So what we're starting to focus on, what are the issues that this kind of community organizing can address in measurable and visible ways. We started with youth employment, and we're moving on to health next because of the $15,000 to $20,000 per resident that's state, federal, or locally funded in high-poverty neighborhoods, $20,000 a year. About 80% of that, or close to that, not actually no, but it could be 80%. In any case, it's about 60% of that. So let's say $12,000 a resident is for health. And a good percentage of that could be reduced through preventative care. It could be reduced if there were stronger social cohorts to help people stay healthy. And so that's one of the ways we're looking at this, is how can we start to line up institutions that care about these results, that could benefit from the savings, to partner with neighborhoods that are ready to do the measurement and ready to organize the local leadership when funded to do so. And to do this within a sufficient set of neighborhoods, 3 to 5, to demonstrate the case, and then scale it citywide, but do that in a way that it's clear to other cities that how to do this.
Wow.
And if you go to the website civicstewardship.com, there's a 2-page overview of a kind of a mini proposal that outlines sort of what that looks like.
Beautiful. I'm conscious of our time. Are there any other questions or comments, Christy, that you can either share or bring in from Pauline?
And Pauline also asked, she said, loving the value of the block steward approach. I'm not picking up a reference to a governance element of this initiative. Can you speak to this, please?
Well, city, state, and federal governments, I think city governments have the most potential. If they have often neighborhood initiatives at the city level, at least in the U.S., focus on the built environment. They don't look at the social infrastructure, as it were. So I think you could have a neighborhood, I don't know, a neighborhood department, which we do have in the U.S., as I said, but it's usually about physical environment, that focuses on the social infrastructure and would take up the research which exists. You can see the links there to current initiatives on block stewards or that type of role, and say, let's target some neighborhoods where there's high opportunity. That is room for improvement, but also local commitment to try something new and to measure the result. And the city could take the lead on how to do that, but it shouldn't own it. It should, I think, cultivate, just as collective impact does, cultivate a kind of community of practice among neighborhoods that are doing this and who want to learn how to do it together. And if you do this in Alberta or wherever you are, we'd love to be part of your community of practice, because we're coming up a steep learning curve on this.
Very, very good. I think there is, I'm hearing this in different quarters, you know, the need to take a look at the different indicator frameworks that do exist, which ones make sense at the neighborhood level, you know, are they health indicators, you know, from a broad sense? Are they capacity building indicators? I also am aware of frameworks that measure or are attempting to kind of capture and monitor resilience of the community. Mm-hmm. There's a group out of Arizona that's doing some really interesting stuff around that. So I do think that the indicator piece is critical because it's an important part of telling that story.
Yeah, and the big headline for us is the Social Trust Foundation for collecting any information, any meaningful information about the social behavioral drivers for outcomes. You can collect health data at a pretty discrete level and safety data at a discrete level, but you can't get the social behavioral stuff, and you can't get it in part because you need social trust. You need the investment in the people that will actually do the interviewing, and you need the people who are being asked these questions to feel like somebody here is going to do something about it. And I'll trust this person because I know her. She lives 3 blocks away from me. And we'll see some activity that's addressing this issue within 90 days. That's what happened in the case of Youth Hub.
Fantastic. So, being mindful of time, I do want to thank you so very much, Bill. And you have shared this with us.
Yep. Yeah. Well, you can go to the website, thecivicstewardship.com.
Yeah.
And there's a link to, I think it says slide set, or it says overview slide presentation, and these slides are there. You can also go to SlideShare and search under Civic Stewardship Snyder, and you can download them from there. And if you download it, you'll be able to go to all the links. Also on the Civic Stewardship homepage, there's a link to the 2-page overview, which itself has a link to a 4-page overview with lots of footnotes that will give you some of the background research on this stuff.
Fantastic. So our commitment is to compile some of those resources, certainly the link to your site, this slide deck from today, and some of the highlights, and get it out to our folks on our mailing list around this community of practice. But I also think it would be worth maybe posting this and sharing it more broadly to our learning community as a whole, if that's something you'd be open to.
Absolutely.
I would, and you know, this feels like a beginning, which is a nice segue by way of wrap up to let you folks know that we are asking ourselves, Christy and I, questions around how to frame our going forward learning agenda for this community of practice in ways that's really meaningful and valuable to you. You know, do we do these one-offs, or, you know, will and others, does it make sense for us to divert, you know, 2 or 3 sessions in a row to go really deep around things like indicators and what do we know and what are we learning and what are some possible frameworks for measuring this work and the importance of measurement. So I think what we will do as well, Christy and I were talking about this before the call, is to, when we send out the data, the information from today's session to everyone, we may include like a short 4-question survey to get your input around how we might design this in ways that's meaningful in terms of advancing your work. So thank you, everybody. Any final comments from our friends in Red Deer, Christy, or from yourself by way of wrap-up?
Well, they said, sounds great, thank you, in terms of the response to their question. And I would also like to extend a sincere thank you, Bill, for sharing all of your work. It is really inspiring and has provided a lot of food for thought.
Well, thank you for the opportunity.
I hope that this is the beginning.
Yes.
As opposed to a one-off, because I think there's lots here.
We are, as I said, the very early part of this this learning curve, and I think there's there really is a lot of opportunity and learning opportunity across cities in Canada and the U.S. and beyond.
Oh, I agree. Well, thank you for the great work you're doing out there in the world.
All right.
Have a great afternoon, everyone.
Take care, everyone. Take care.
Bye.
Bye.
Bye.